Okay, bye. We're good. All right.
All right. Hi, I'm Larry Johnson. I'm a professor at Texas A&M University, and I want to welcome you to our Science Education Partnership series. The first of this series has to do with the Veterinary Emergency Response Team that will be talking to you today. We want to welcome those individuals from other states. We have some from New Jersey, California, Kansas, as well as many people from Texas. This transmission is brought to you by the Partnership for Environmental Education and Rural Health, PEER, which is funded by the National Institute of Health through the SEPA program. That's a Science Education Partnership Award, SEPA. PEER develops curriculum for middle school and high school. They also have teacher training, and they produce have scientists or veterinarians or vet techs go into schools and give presentations. This presentation is brought to your school by telecommunication, and PEER is one of the outreach components of the College of Veterinary Medicine and Biomedical Sciences, and it is my pleasure to introduce the Dean, Dr. Eleanor Green, who will tell you a little bit about the college as well as introduce our speakers today. Dr. Green.
Good morning, or howdy, as we say here at Texas A&M. I'd like to thank you, Dr. Johnson, for arranging this conference, but also for all you do for the PEER program. It's a magnificent program that reaches a lot of high schools and middle schools throughout the state and beyond. As Dean of the College of Veterinary Medicine and Biomedical Sciences at Texas A&M, I'm pleased to welcome you to this video conference. I understand that many of you may be interested in becoming veterinarians or veterinary technicians. So with that, I'd like to tell you a little bit about our college. First, it's the only College of Veterinary Medicine in the state of Texas, and we think one of the best in the world. Well, let me give you some evidence. A Wall Street Journal article recently published the results of a survey of corporations across all of the United States about where they went to get their graduates. Well, Texas A&M ranked second in the nation. That's second in the whole nation. So we think that's really good. In addition to that a business manager from one of the most prominent private veterinary practices in the United States recently said that he would hire a Texas A&M graduate on the degree alone. No resumes, no letter of reference, just a degree from Texas A&M. So this is a very special place. Not only do we train veterinary students, but we also have an undergraduate program in biomedical sciences called BIMS. BIMS is a pre-professional program which prepares students to enter any of the health profession schools, veterinary medicine, medicine, dentistry, many of them, nursing, etc. It has a very diverse student body and many first-generation college students. And also, these students perform very well when they apply to these health programs. So we're very proud of that program. We also have a relationship with Blinn College in training veterinary technicians, their veterinary technology program. And these students will come to our hospital and help train with our own veterinary technicians that we have in our hospital. As you will see when you hear from Carin and Lessa Block, veterinary technology is a very important and most rewarding profession. I know that we could not do without them in our hospital at Texas A&M University. Our college reaches out to serve all of Texas, its animals, its animal-owning public, and society. One of the many ways is through PEER. Another is our vet emergency team, which Carin and Lessa will discuss with you in just a few moments. The magnitude of what the veterinary emergency team has done and will do cannot be measured, but it does help explain the greatness of Texas A&M and the spirit of Texas A&M. So it's now my pleasure to introduce to you Carin and Lessa Block. Carin is a registered veterinary technician who works in the small animal clinic at the College of Veterinary Medicine and Biomedical Sciences. She assists third-year veterinary students in their anesthesia courses, but she's also involved in collecting data for many research projects. She attended Tomball College, where she studied veterinary technology, And her career has spanned work in medical research to private veterinary practice to the academic institution at Texas A&M, which she considers her dream job. Lessa Block, graduated from Angelo State University with a BA in animal science, and she is a registered veterinary technician who works in the small animal intensive care unit at Texas A&M University. She's very skilled in emergency care for small animals, and she's the go-to person for IV catheter placement and wound bandaging. So both of these are examples of a wonderful career and wonderful people as veterinary technicians. And again, they're going to tell you about this veterinary emergency team because it was a very special team and they do very special work. So Carin, Lessa, it's all yours.
Thank you, Dr. Green. Howdy. All right. Before I get started, I wanted to read a snippet from one of the emails our head veterinarian, Dr. Wesley Bissett, for the vet team sent out to not only members of the vet team, but as well as his own family members and friends. I'm going to warn you, it might be a little bit difficult for me to read this. The Bastrop fire was not our normal day-to-day activities within the Texas A&M Vet School. It was very difficult as veterinary technicians and veterinarians and students to be there, to see the devastation, to see the animals that were injured. But I wanted to go ahead and read this to give you kind of an idea of what we saw and how we felt before I get into the mechanics of what we did. This is from Dr. Bissett. I want to try to give each of you a sense of what it's like to be here. Many of you have seen the pictures and videos of what happened to this town. In terms of residential loss, this is by far the largest fire in our state's history. It came during the day while people were at work. When they left their houses standing and their animals were happy and healthy, then the fire came. People lost everything except their lives. You all know just how long this has been going on. There are still many who have not even had the chance to get in to see what they have left. All they know is what is printed on a page, taped to a wall, the list of destroyed homes. This is the environment we wake up to, and that each of you share with us. I want each of you to try and imagine something. Imagine a cat placed on an exam table. Its hair is singed, its paws are burned. What did that animal go through? Will it survive? Will it be reunited with its owner? There are stories of animals and owners reuniting, and I promise you the tears will flow. Excuse me. Like I said, this is very hard to go back and relive. We all feel it, deployed or not. We know just how precious these moments are, especially when that animal is all that is left for a person's former life. They are tears of happiness and sadness as well. The sadness comes because you realize there are so many animals that did not survive the march of the wildfire. There are so many families that will not be reunited. There are so many thoughts of what those animals, dogs, cats, horses, cows, went through. The happiness is that we get to witness a search for hope. Imagine a fireman jumping out of his fire truck with an injured animal in his soot-stained hands, all present in this to save a life, to make someone's life a bit better. We need our hope. Even in these troubled times, I am certain that things will be okay. They will be okay because of people like each of you. Our team will push through this long deployment because we know just how very special all of you are. This is a special place. You are a special person, committed to helping someone whom you may never get to meet through a tragedy. We all perform with the true spirit of a Texas Aggie. And that's a very small glimpse into what we experienced. I can tell you from the pictures do not do the Bastrop fire justice. Complete and utter devastation, and then there will be an untouched home, an untouched barn, for no reason other than that's just how wildfires work and the act of God. And it was very hard for each of us to witness that and deal with that. But without further ado, I'll start our presentation. We thank you all for joining us today. Where's my little pointer? The other pointer. Okay. All right. So they can all see that now? Okay, great. So we thank Dr. Larry Johnson and Dean Green for joining us, and we thank you all for sharing your morning with us as we share with you what we experienced and show you a little bit into the life of a veterinary technician on deployment with the veterinary emergency team at Texas A&M. The Bastrop fire is formally named the Bastrop Complex. Each fire is giving an official name, and that is how the officials refer to each fire. Okay. A little bit on our history. Texas A&M College of Veterinary Medicine and Biomedical Sciences has been an active participant in assisting the citizens and animals in the state of Texas in times of emergency in the last decade, particularly with hurricanes. As you all can remember, we've had Katrina and Rita, which were fairly significant events between Louisiana and Texas. Katrina was not so much an issue for Texas as it was Louisiana, as we all know with New Orleans. However, as we sat and watched the events unfold during Katrina, we realized that there was a need. During Hurricane Rita, we became a human surge hospital. And what that means is our large animal hospital was evacuated of all large animals, and we became a human surge hospital for over 300 patients from the Texas coast. Faculty and staff and students played a critical role in animal patient evacuations to other facilities, meeting the needs of our human patients. Oftentimes there was not enough staff, so veterinary staff filled in and helped with delivering and sometimes even feeding meals. There were some patients that were unable to feed themselves. Assisting the human medical staff with patient care, and that's anything from helping with oral medications to, unfortunately, bed sores and diaper changes in geriatric patients. Overall, attending to the needs of the evacuees. Many members of our staff, veterinarians, faculty, interns, residents, technicians, would just spend time with the evacuees, talking with them. Many of them came from nursing homes, and so they were obviously lonely and scared and not sure what was going on. So just a kind person sitting down and having a conversation lifted their spirits greatly. And then returning the large animal hospital back to an operating veterinary referral and teaching hospital. Once everybody left, we were left with cleanup, and that we had to scrub down the entire hospital. And if you've ever been into the large animal hospital at Texas A&M, you can see that it is quite large, especially by this picture here. Let me explain what's going on in here. This area right here is called the Four Corners. And the hospital is basically a cross or a giant X. Down here where my pointer is, we had a little food station where we were collecting meals and delivering them to the patients. Down here, right here, this is a big sliding door. This is actually one of our equine exam rooms. In each of these exam rooms, and then down back through here and around the corner, were beds, and many human patients were occupying those beds. We have back here, down the hall, we have a internal medicine wing for equine patients. Those stalls were also used as bedrooms or rooms with cots. If you come straight up here, this is our food animal, surgery, and radiology wing of the hospital. As you can see, all these people here are laying out in beds, cots. And then back in this part of our building, as well as in this part of our building, this is the surgery side, this is our food animal and radiology side, we had cots set up in those rooms as well. Then this is the front of the hospital where we had kind of a waiting area set up, and then back down this side of the hospital was recovery rooms for our equine patients, as well as our equine ICU and our equine surgery barn. Again, all those occupied rooms were emptied, and we had cots placed for evacuees. And so you can see we were quite busy with our new human patients, and it was quite an experience as well. Here's a picture of our equine ICU, and you can see here's a stall. The door slides shut, and we have set up cots. We have cots on the outside, and then right here, you can barely see it, but those are actually baby cribs that we had brought in for infants that evacuated. The Small Animal Clinical Sciences oversaw the Small Animal Evacuation Center in conjunction with the Brazos County officials. So we also dealt with small animal issues during RETA. VMTH continued to provide small animal veterinary medical care. So while the large animal hospital was essentially closed to large animal patients, our small animal side continued to see patients as they came in and continued fairly normal operating procedures. Large Animal Clinical Sciences developed an alternative location to provide triage and evacuation of large animals at a private off-site location. At this time, we really didn't have any plan as far as large animals and dealing with any issues that came up. We saw several animals that were brought to us through evacuation from RETA that were suffering from heat stroke, from being in cars, sitting on the highway, not moving for a long time. So we dealt with those issues as well, but we hadn't formally developed a plan for our large animal patients. Right. Okay, so on Gustav, Gustav didn't really affect the Texas coast. It affected Louisiana. But this was the first hurricane where we actually had a plan in place. We realized with Hurricane Rita and Katrina that we needed a plan, and this is where we developed our plan. And I'm going to let Lisa talk about Ike, as she was here for Ike.
Thank you, Karen. So the difference with Ike as opposed to Rita and Katrina is, like Karen said, we had a plan in place for the influx of animals that we were going to receive. Even though the state of Texas also had more of a route planned to be able to evacuate all of these people, there was still long lines. From the Galveston area, we received about 200 large animals. I can't even tell you how many small animals we received that, once again, were stuck in vehicles and heat stroke and all of that kind of stuff that we had to care for within our hospital.
Ike was a landmark event. This was the actual implementation of our large animal shelter plan. This is where we actually got to use this plan. It was also the official inclusion of veterinary students into our emergency response efforts. Our students provided triage and monitoring of large animal evacuees, viewed as an overwhelming success by animal owners who evacuated to Brazos and surrounding counties, and provided an educational opportunity for students, which leads to an increased number of veterinarians in our state who are well versed in emergency response. There are certain requirements before deployment for the vet team. All veterinarians and technicians and staff had to take ICS Incident Command System Emergency Management Training, and this included classes 100, 200, 700, and 800. That was all done online. Additional non-required training additional technicians and veterinarians may have took were 300 and 400. And what ICS Incident Command System is, this is the system that all government agencies use, whether it be for a natural disaster or a major event. Think like the Super Bowl. They use this system to do chain of command and to provide for their responders and such. Entire team had to declare availability to deploy and make personal arrangements for family and animals. We're just like everybody else. We have our family, we have our own animals, we have our own property that we have to take in consideration when we leave. for a deployment, and in the state of Texas right now, the entire state is in extreme drought conditions, and so what happened in Bastrop could easily happen here in College Station. It's happened in Grimes County twice now, including Montgomery and Walker County, I believe so, which is the Tri-County fire, plus numerous... Leon County and numerous other counties as well have been dealing with small fires. There probably has not been a single county that has not had some sort of wildfire in the last six months.
Carin, did you say that there was a fire actually threatening your home area when you were deploying to the Bastrop area?
The day I was told to pack my bags and make arrangements, there was a pasture fire a mile from my house.
I had the same type situation. 2 days before deployment, I got a call at 3 o'clock in the morning to be ready to evacuate.
Right.
3 miles from my house was a fire.
So while we were there in Bastrop helping them, we were all worried about our own places and our own families and animals, and so that takes a toll on you emotionally. Our support has to be officially requested by either a county judge, the Texas Animal Health Commission, or the Texas Task Force 1. We cannot see an incident occurring and just decide to deploy because we feel that there are animal needs. We have to be formally requested through the ICS system to be deployed, and then and only then can we deploy. Our official deployment mission was to support the Texas Task Force 1 service dogs and their handlers. These dogs were used for finding remains of individuals who may not have been able to escape the fire. There was great concern as how fast this fire did actually move. And then care of affected animals from the wildfire was a secondary mission that developed after deployment. So who came? Veterinarians. We had Dr. Lessa Howe and Dr. Leslie Easterwood join us. Dr. Howe is a small animal veterinarian, and Dr. Easterwood is a large animal veterinarian. We had technicians, myself, Dana, Lisa, and Melissa. We had staff, and then we had students as well, and we had several waves of students. I think we had, three?
3 different waves,
Three
with 3
different
students
waves.
each. So we had 9 students total.
You mean veterinary students?
Veterinary students.
4th-year students that have gone through all of the training as well.
Right. They have to take an elective and then also have to take some of these tests as well. Okay. So each of us brought a multitude of talents and skills. We had a pretty even group of large and small animal veterinarians and technicians responding, and each of us provided something so that we could function as a well-oiled team.
Carin, as Dr. Green, Dean Green, said earlier, Carin is an RVT. She has been with us at the College of Veterinary Medicine. She started in 2004 with anesthesia, and then she moved to a research position where she assists third years with their third-year surgery.
Yeah, clinical anesthesia.
Their clinical anesthesia. And Carin was awesome on deployment for us in the fact that she also has wildlife experience. So for those of us that didn't, such as myself, she came in extreme handy with her anesthesia experience and her wildlife experience.
That's me with Reveille, in case anybody doesn't realize. Reveille is our mascot. And so at any opportunity she presents, we always get a picture of Reveille with our gig 'em thumbs up.
Dana Whitaker, who couldn't be here with us today, is also an RVT. She's been with us since 2005. She as well started in the anesthesia department and now is in the soft tissue surgery department. So she is extremely knowledgeable on wound management, which came into play a lot with the wildfire and all of the burn pads. So her knowledge on bandaging techniques and how to treat the tissue came in it was extremely helpful with us and actually helped us, the rest of us, be able to learn to bandage these guys and made everything move faster.
Exactly, because it's been a long time since I've bandaged anything.
That's Dana.
Yeah, here's Dana. Okay, so Lisa, she graduated from San Angelo State University with a bachelor's in animal science, and she joined us in the small animal ICU in 2003 till currently. She is also an EMT with her certification in 2010. Lisa's skills were excellent in that since she works in such a high-stress environment at the hospital in ICU, that she's able to recall drugs very quickly in their dosages and able to calculate them very quickly, because there were numerous animals that benefited from some sedation and some pain medicine, as well as her own bandaging skills are highly proficient. Melissa Welch, she couldn't join us today. She joined us in 2001 after several years in private practice. She started in equine internal medicine and then moved on to food animal medicine, where she is currently, and her skills as well with hoof stock, including her private practice experience, was very, very beneficial, because this was definitely all hands-on deck experience where we all played a part, we all assisted each other. So we had a great team of technicians put together. Task Force 1.
Our main deployment purpose was to help with the Texas Task Force 1 dogs. Our help with the wildfire victims came secondary. We were called and met with the task force, where we went right on in line with them in their convoy, as you can see in the pictures. That's us right behind them. They kind of took us under their wing and said, "Come with us and we'll take care of you. You take care of us, we'll take care of you." Their dogs are put in these extreme circumstances where they have to work in these harsh conditions just like their human handlers do. And we were there to help them get these dogs through this.
Just wanted to point out, this is the convoy. We're in the middle of the convoy here. And actually, I kind of thought it was funny that I caught burn ban in force in the picture. Here is one of their trucks and trailers. Here are the vans that the dogs and all the search and rescue individuals arrived in. This here is their forward operating base camp at the Valero station. This was our first camp. And then here is a little peek into what we did. This is a group of technicians and students working on a SAR dog. This is probably Sarge. He's probably getting some IV or sub-Q or IV fluids right here, and probably getting his feet bandaged. Texas Task Force 1, for those outside of Texas that may not have a task force and may not know what it is a multidisciplinary search and rescue, medical and hazmat and weapons of mass destruction team. Primarily a lot of fire departments, and they are the busiest task force in the nation. They get called out at least once a year.
They responded to 911 and things like that.
9/11. They were at Joplin. Yeah, so that's them.
That's them.
They're a good group of guys and ladies. I mean, they are awesome. Here's a picture of one of the destroyed homes. Here are our Task Force 1 guys. This looks like to be what best described as a Texas rock granite house. It's built or used on the outside of lots of native rock, and it looked like it had a metal roof at one point. And as you can see, it's completely, if I didn't tell you that this had been a house, you might not have realized it, because a lot of our homes here in Texas had these metal roofs. So you could see how hot this fire was. Okay, so this was our first deployment, and we did not know what to expect or what would be expected of us, and it was an evolving learning experience, and each day was different. We actually, when we formed this team, officially formed this team back in October, we were focused on a hurricane. We were planning for a hurricane, and we got a fire, and that's two totally different animals. This was actually also TTF's first fire as well, so they were a little bit unprepared. As you can see here, this is Dana with one of our bandage packs, and we were going over and looking through. Lisa here with our IV fluids and drug pack, and this is all we had that first day. Here's one of our first patients. This is our Suburban we came in. We had to borrow this table from TTF, and this is one of our first animals. It was a dog, but then we started getting an abundance of kitty cats. This kitty here had all 4 paws burned, and so had to be sedated, and then his wounds lavaged and then bandaged. This kitty here, if you'll look closely, I know some of you might not be able to, but look at the hair coat. The hair coat is very singed. His whiskers are singed. His eyes are very glassy. He's very dehydrated. And then this kitty here, if you can see right there, he's got some singed whiskers as well. Very miraculous that these animals survived, as many did not. We learned that it was far better to take everything that we had and then send the rest back, because unfortunately, like I said, this is what we had when we got there on that first day, because we did not know what to expect. We weren't sure if we were going to have any animal patients other than our SAR dogs, and we were quickly proven wrong.
And again, one more time, tell them where that is, that y'all can probably tell from now. That's not a veterinary hospital.
No, we are in the parking lot of a Valero station on Highway 21. And we're on this side because there was shade. As you know, Texas has had extreme heat this year. The TTF1 guys, they're under the awning for the gas pumps. And so we're on this side because there's lots of shade, nice little parking area, and a dumpster, which was very convenient. The dumpster was untouched.
And I'll tell you, all around this Valero station is burned.
Yeah, completely burned.
Except for this station. Everything around it, all the trees, there was even still a tree stump burning right behind us.
Right. So this was our first day as well. This is one of our SAR dogs. He had stepped on a piece of metal going over the rubble and had to come back for a laceration repair. Unfortunately, I'm going to point this out. These are non-sterile gloves. These are a non-sterile pair of instruments. The only thing sterile was an expired piece of suture, which really we don't consider sterile. It was field MASH Army type medicine in a pinch, and fortunately this dog did very well. We had antibiotics, so he did great. And his handler did a lot of good first aid when it initially happened, so that helped a lot. That evening, we called for our veterinary trailer. This is a surgical trailer. As you can see here, we've got our little hurricane symbol on because we thought we'd be doing a hurricane. And we would take the animals into the surgery trailer and work with them in the air conditioning in the trailer. And as you can see here, we did a lot of standing around and waiting on animal control to bring us animals, as well as the SAR dogs to come back. So there was some downtime where we could finish our paperwork. Then here we are in the trailer, and this is this kitty I showed you before. He is currently being woken up. He had some IV sedation and then needed a little bit more, so we masked him. And we've got students here that are, she's getting ready to treat the eyes. Josh here is writing down notes. I'm back here messing with the anesthesia machine, probably turning the inhalant off and the oxygen on. And so we're waking up this kitty. He's already had some IV fluids here, as you can see. We continued to get busy as the days progressed. Here we had to set up another table outside to help deal with large dogs that came in, while we were also working on smaller animals in the trailer. When animals were brought, it was very much like a wave. In the morning, we'd work with the SAR dogs, get them IV fluids, get their feet bandaged, and send them off. And then about an hour later, animal control would come with their first load of animals. And that could be anywhere from 1 to 7, 8 animals that needed our attention. Fortunately, many animals that they brought us were not injured, and so we were able to send them on. Here is Sarge, and you can see we're still working on the pavement with our SAR dogs. We had up to 6 dogs, and so it just wasn't feasible to put them all in the trailer to work with them, so we spread out in the parking lots and gave them their IV or sub-Q fluids and bandaged their feet out there. A little hectic in the mornings and in the evenings when they came home, but we got it done. Then we decided we needed our big trailer, and this is our surgery trailer here, and this is our big
bunk trailer.
What it really has in there is 14 beds, and these beds fold up against the walls, and so where we also have some of our equipment stored. So we pulled all that out and used it for our SAR dogs. So the SAR dogs got to come in and take a break in the air conditioning while we, gave fluids and checked their feet and whatnot. And then we were finally able to use our surgical trailer, what it was meant for, and this was, we actually did a dog castration, and it was a dog, we were stationed at Camp Swift, which is a National Reserve base camp, and they had a couple dogs there that they needed to find homes for, and Texas Task Force 1 guys adopted him, and we neutered one of them for him. We also did a mass removal on a cat tongue, and took care of that so that when that cat was reunited with its owner, it had an even better chance of life. And that cat was actually very geriatric, and I just saw yesterday that the Austin Humane Society reunited that kitty, and that kitty was 20 years old. Survived the fire, 20 years old.
Survived the fire, burned feet, and we just happened to find his little tumor in his mouth.
So we took care of it for them, and so I'm sure they're extremely happy. Okay, so communication and media. This is the interesting part. You guys are going to love this. Facebook. I know everybody here has a Facebook page, and if you don't, well, you will. And, Facebook is one of those things that a lot of people think is a big time waster, and it's just something to do to keep track of friends and family. Facebook was an extremely useful tool in spreading the word regarding the status of the fire. Texas Forest Service has a Facebook page, and they would update the status of the fire frequently.
It helped us keep in touch with containment, for
Right.
instance. We would know daily how much was contained, which was nice to know.
Right. Also, locations of human and animal evacuation sites. This is extremely important for people, and if you don't have Facebook, I think this is a good reason to have Facebook. Find out your local county. This here is the Brazos County Official Office of Emergency Management. They listed human evacuation sites and animal evacuation sites, because once you leave your home, if you have several animals, what are you going to do with them? It's not a good idea to take them to your local veterinarian. He or she is already overburdened with injured animals from the incident, and so there are lots of individuals who, like at the rodeo arenas in Elgin and in Bastrop, set up evacuation sites for people to bring their animals. Austin Humane Society also had an evacuation site, so that is extremely helpful. Texas Animal Health Commission was a good source for that information. And then the rescue and relocation of animals. The Austin Humane Society nailed it. They had their Facebook page, and they took pictures of every single animal. And so that helped owners find their animals. Let's see.
It was also nice for us because we treated these animals, and then the Austin Humane Society would take them to their clinic. And you lose that communication where we didn't know what happened to the animals that we treated. And being able to look on their Facebook page, they were so good at uploading pictures and saying, this animal found its owner. Well, we would remember those animals, and they would stick out. And that way we knew as well that they had found their way home.
Right. And that was one of the first things. The first animal I placed my hands on, I looked at the animal control officer, and I said, how are you going to find its owner? And he said, I don't know. And Austin Humane Society answered that question, and they did an extraordinary job. Okay, so the vet team and the SAR dogs. Our primary mission was to ensure the health and safety of the dogs. This here is Brick, and here is Jetta, and this is Scotch. Scotch is not always this serious. Here is Sarge, and here's Zasha, and then we have Joker.
And Joker was a joker.
And if you can tell by the inflection of my voice, we became attached to these dogs. These dogs were just as important to us as they were to Texas Task Force 1. Our primary concerns included dehydration, pad injuries related to crawling over rubble, and pad burns due to walking through smoldering and hot ash. And that's one thing a lot of us I don't think even thought about, is that even after the fire is gone from that area that we were in, that ash was still hot, and it was inches and inches and inches of it. And so while walking through it with leather soles on your boots was fine, these dogs didn't have any protection on their feet. And having never done a fire before, that was something that we just took for granted and really didn't think about. So dehydration was addressed twice a day by administering sub-Q or intravenous fluids. Handlers also made sure to take water breaks for the dogs by carrying collapsible bowls and water bottles. I think Lisa can comment on how the dogs did, because you worked with these dogs before.
Yes, I worked with the dogs, and I worked as our dog myself, and Katrina, which was a completely different experience than the fires for the dog's sake. These dogs, being in that extreme heat, they're closer to the ground than we are. Their feet, the dog handlers started with commercialized boots, the little booties that are made for dogs. They were using these. Well, as Carin said, the ash was so deep. The ash was getting in those booties. They couldn't make them tight enough but to where that they would stay comfortable for the dogs, where they couldn't get ash down in their boots. So we modified them a little bit and started making our own boots for them. We called them their Nikes. As you can see, Sarge is wearing his Nikes, Brooks is wearing his Nikes. They all had Nikes on. And they didn't mind their Nikes after about the first 5 minutes. They were fine with them. In the fire situation, they worked great. They didn't get ash down in there. We used, as you can see, duct tape. Worked great for the rough terrain. The only thing is it did make it to where if these dogs had been on rubble, for instance, they would have had a hard time gripping. That was the only nice thing, is being in the fire, this worked beautifully. In a rubble situation, it probably would not have. So we would have to adapt to that as well.
Okay. So how were animals identified and rescued out in the environment? Search and rescue individuals or concerned homeowners would identify locations with known animals and then contact the sheriff and or animal control. And here's a picture of one of the TTF guys with a kitty he found. He's taken it to animal control, and then we eventually saw that kitty. Then animal control would dispatch a truck to rescue animals identified and any animals seen while en route. They hauled out every single animal that they could catch. Because there's no food, there's no water, there's nothing. Animal control would then return to the forward operating base for the vet team to triage wounded and dehydrated animals. This paw right here, as you can see, it's pretty severe burns, and then the burns ooze, and then it packs in ash, and so that had to be lavaged. Here's our kitty again, and then here's our kitty recovering. Once treated and recovered from sedation or anesthesia, animal control would transport the injured animals to the Austin Humane Society and the uninjured to the Bastrop Animal Shelter. And here's one of the animal control trucks here with a student and an animal control officer placing an animal in it. Again, once at the Humane Society, they took pictures of every single animal that came through the door, including pictures in Bastrop. So they took pictures of every single animal. Here's an uninjured kitty looking for his owner. This is actually the burned paw pad. This is actually the dog that pad is a picture of. She was one of our second or third patients. And then here's another scruffy dog who survived the fire. Every single picture was placed in an album on Facebook for owners to locate and identify, and then once identified, each heartwarming reunion was photographed and placed in an album on Facebook as well. And so here I've taken, with permission from Austin, several of the reunion pictures, and it brings a tear to your eye and warms your heart to know that these people may have nothing left, like Dr. Bissett said, but they have these animals because Bastrop County, Austin Humane Society, TTF1, and Texas A&M went in and helped them recover these pets.
Carin, tell them like you told me that getting these pictures was so important to you guys because you kind of got almost, I don't want to say a depression, but you kept wondering what's going to happen to these animals, and this made all the difference.
Coming home and coming back to your normal life, it's very difficult because there's no closure. And so having these pictures and knowing what's happened with these animals provides excellent closure for us. Actually doing this talk is excellent closure for us because it helps to talk about it, to tell you what we saw and how we felt. So it makes our day to see these pictures of these animals going home. Austin Humane Society reunited over 240 animals, and I'm sure that number is much larger now. Like I said, I saw yesterday they reunited another animal. It helped the homeowners with their healing process. It helped us with our healing process, and it's been said over and over and over again since we've come home that we hope that in the future natural disasters that communities look to Austin, that state government and federal government looks to Austin, looks at this fire, and looks and studies how this happened, and it was seamless. Absolutely seamless on getting these animals out and getting them back to their owners, and that is important.
I talked to them on the phone a couple of days ago. They said they only had 10 unclaimed animals.
That's wonderful.
Sounds like another one may have, and those are the only animals out of all of that are up for adoption that have not been claimed.
That is awesome. So how can you help? Well, the vet team is funded through grants and donations from corporations, government, and private individuals. Donations can be made online at, I'll give you all a moment to write this web address down.
We're also going to send this to all the emails of the teachers that have signed up.
Awesome.
Remotely, so we'll make sure they all get an email with this information.
Right. Awesome. Yes, we do accept donations, and we do need donations. I'm not here looking for donations. I'm just sharing our experience. But if there are classes that want to do fundraisers, I know Dr. Bissett and the team would greatly appreciate anything. We've learned from the experience that the trailers may not be exactly what we need, and so we're looking to get more of an RV type setup. That's kind of where we're going. We're constantly looking at it and deciding what else we need and how we can make it better. I think that's enough time. And then, are there any questions? Let me go to camera. Yes.
Personally, what initially interested you in becoming part of the veterinarian emergency team?
Katrina, for me. When Katrina hit and we saw all the animals being left behind and people being turned away and having to make that choice between evacuating and saving themselves or staying home and staying with their animals because the animals weren't allowed to go, it was right then and there when I said, we need to do something. And so I am so very happy that Dr. Bissett took this by the horns and made it a reality, because now I can do something.
For me, I've been in the field for so long now, and I've always worked in either emergency or the ICU, and I have always taken care of the most critical patients. It was the fact of being able to do more for these animals and being able to share our expertise that we've learned being in the best, as I feel, the best place in the world to work, which is at the vet school at A&M.
You had a question?
I was wondering, was it just pets, or did you also deal with wildlife?
We dealt with wildlife. We had a couple raccoons come in, some fawns, some birds. So we had multiple species, and that's